Tuberculosis or TB is a disease that infects the lungs and may also attack other parts of the body such as the brain or spine. The TB epidemic is growing worldwide and education of proper treatment is key to avoiding infection.
TB is caused by the Mycobacterium tuberculosis bacterium that is spread through microscopic droplets released into the air by coughing or sneezing, making it an extremely contagious airborne disease. Poorly ventilated and overcrowded housing, primitive sanitation, malnutrition, and other risk factors led to the rise of the very common disease.
Tuberculosis exists in two stages, latent and active. Latent TB is when the bacteria has infected a person but is still dormant, and at this point it has no symptoms and is not contagious. If you are at specific risk for TB, it is important to get tested regularly so the doctors can begin treatment before it becomes active.
Active TB is much more serious and difficult to treat, some general symptoms being coughing that lasts more than 3 weeks, chest pain, sneezing, fatigue, and fever. Without proper healthcare professionals, TB diagnosis is very difficult and can include more complicated symptoms, such as coughing up blood, night sweats, unintentional weight loss, or loss of appetite.
People who are HIV/AIDS positive or have an otherwise weakened immune system are more at risk, as well as seniors, young children, and people in developing countries with limited access to healthcare. Unfortunately, TB has become a growing issue in all the areas of the world, being in the top 10 causes of death worldwide and infecting a third of the global population in 2015. Here in Canada, there were about 1,500 cases of active TB diseases reported in 2014, with an overall incident rate of 4.4 people infected per 100,000. Fortunately, in Canada, 82% of all reported cases were cured or had completed treatment. However, tuberculosis is a deadly disease, killing 1.8 million people out of the 10.4 million cases in 2015 worldwide. 95% of these deaths occurring in lower medium-income countries. To further the problem, TB accounted for 35% of HIV deaths, making it the leading killer of HIV-positive people who are less able to fight off the infection.
TB diagnosis is crucial to recovery. The primary method of diagnosis is a skin injection of tuberculosis, non-infectious protein, into the skin to determine if the bacteria are present. Then, if tested positive, further tests are required to determine if the patient has latent or active tuberculosis. If not treated properly, latent tuberculosis can progress into an active infection and can be cured with either isoniazid or rifampicin drugs, or both in combination. When the bacteria become active, it is very important that patients finish their treatment plan and take the drugs exactly as prescribed. If treatment is not completed, the disease can resurface, and if medication is not taken correctly, then the bacteria can develop drug resistance. Drug-resistant TB is when the disease does not respond to isoniazid and rifampicin, and possibly other medications as well, making it significantly harder to cure.
In a normal TB case, for 2 months, an infected person will need to take a combination of 3 to 4 antibiotics every day. Then 2 antibiotics are usually taken a few times a week for another 4 to 7 months, depending on the case. Although if infected with multi-drug resistant TB, then different medications will need to be taken for 18 to 24 months.
The spread of tuberculosis can be prevented with proper hygiene and rest in a properly ventilated, non-crowded area. Contrary to popular belief, completely isolating infected individuals is not necessary, as they are no longer contagious once treatment has begun. But healthcare professionals should use respiratory protective equipment when working in a high-risk environment to avoid infection.
Some countries with high rate of TB even have a preventative vaccine for children called the BCG vaccine, but it is not known to be very effective in adults. Overall, recovery time and progression of TB can be reduced when people are educated on the importance of properly following their treatment plan. One of the new Sustainable Development Goals is to end the global tuberculosis epidemic by 2030, and with your further knowledge, we can fight back.